Hello students, a warm welcome to all of you in ITLS Academy. In today's lecture, we will discuss about the anti-cancer agent and antibodies. Okay, so we start today. We start today's lecture. First, we understand what is the anti-cancer agent. Anti-cancer agent is also known as a antineoplastic agent or chemotherapy drugs. Okay, they are diverse group of medication designed to treat the cancer. Okay, these anti-cancers are used to treat the cancer. Okay, the primary goal of this particular disease to destroy, to kill, or to shrink the slow growth of cancerous cells. These agents work by integrating with various processes that are essential for the cancer survival, proliferation, often targeting and rapidly dividing cells. Okay, what are the anti-cancering agents? Anti-cancering agent drugs used to treat the malignancy, to kill or to inhibit the proliferation of the cells, also known as the antineoplastic or chemotherapy agents. Okay, these are the different types of anti-cancerous agent, like alkylating, alkylating agent, anti-metabolites agent, natural agent, antibiotics, hormonal agents, enzyme, target therapy, monoclonal antibody, and immunotherapy. And these are the example of cyclophosphamide. This is a type of alkaline agent, and the mechanism, it will form the covalent bond with DNA, cross-linking and inhibit the replication and transcription in cancer cells. Fluorouracil. It is an analog of normal metabolites interface in RNA and DNA synthesis. Like alkaloids. Weaker alkaloids inhibit the microtubules, assemble taxon, stabilize the microtubules, prevent the disassembly of mitotic arrest. Okay, like doxorubicin. It is an interchelating DNA inhibitor, topoisomerase 2, or causes the free radical damage. Okay. Next, hormonal agent like tamoxifen. It blocks the hormonal receptor, inhibit the hormone, synthesize the hormone dependent cancer. Enzyme like asparaginase, deep deprinase leukemic cells of aspirin, like imatinib, inhibit the special molecular target like tyrosine kinase. Rituximab bind to a specific agent, specific antigen of cancers to induce the immune destruction or block the growth signals, like Bimulinof, immuno checkpoint inhibitor, enhance the T cell activity against the cancerous cells. Okay, these are the agent, these are the drugs, and this is the mode of action. Okay. Now, based on a cells and cell specificity, cell cycle specificity agent affect the specific phase. Like antimetabolites, it will affect the S phase. Weaker alkaloid, it will inhibit the M phase. Cell cycle or non-specific agent act on any phase included in resting phase, like alkalining agent or anthracyclines. Okay. General mechanism of action: DNA damage, inhibition of nucleotide synthesis, inhibition of mitosis cycle, topoisomerase inhibition, target pathway inhibitor, or immunoactivation. These are the different general mechanism to treat the cancer. Now, common side effect. Common side effect due to the cancer, like myelosuppression, suppression of backbone activity, lead to the low blood cell counts. Gastrointestinal toxicity, like nausea, vomiting, diarrhea, constipation, etc. Hair loss, fatigue, fattiness, skill and nail changes. Neurotherapy means nerve damage, organ damage, okay, and reproductive issues. These are the side effects of cancer. Now, neurodevelopment types and their feature. Target therapy. Target therapy, and the key feature of target therapy is greater specificity of the cancerous cell, less damage to normal cells. Immunotherapy enhances the patient's immune to fight against the cancerous cells. Nanoparticle formulation improve the delivery, reduce the synthetic toxicity. CAR T cell therapy, genetically engineered T cells targeting the tumor antigens. Okay, these are the new therapies to treat the cancer. Okay, application in treatment used as a monotherapy to combine the resin to increase the efficacy and reduce the resistance. Adjuvant therapy means post-surgical to eliminate the reducing cells. New adjuvant therapy before the surgery to reduce the tumor size. Palliative therapy from the symptom release in advanced cancer. Okay, these are the application of this is the application in treatment. Okay, this is all about the anti-cancerous agent. Okay, now we understand what is the antibiotic. Antibiotic is a chemical substance produced by the microorganisms that inhibit the growth or destroy the microorganism. The main purpose of antibiotic to treat the bacterial infection. It will not effective against the viral infections. Okay, it will only affect in treatment of bacterial infection. This is the classification of antibiotics. Basic by sources. It is divided into three parts. First, natural, synthetic, and semi-synthetic. Example: penicillin, ampicillin, and sulfonamide. Penicillin is a natural, ampicillin is a semi-synthetic, and sulfonamide is a natural. Mechanism varies. Wide spectrum, narrow and broad spectrum. Narrow and broad spectrum, penicillin G is a narrow spectrum, tetracycline is a broad spectrum. Against the gram-positive only, and tetracycline is used for gram-positive as well as gram-negative. Mode of action. First mode of action to cell wall synthesis inhibitor, protein synthesis inhibitor, nucleic acid synthesis inhibitor, or cell membrane disruption or metabolite inhibitor. These are the different mode of action. And the antibiotic like penicillin, cephalosporins, amyloglycosidase, tetracycline, macrolides, quinolones, rifapens, polymyxins, sulfonamide, and trimethoprim. Okay, these are the different types of antibiotic, and the mechanism inhibit the respective bacterial process. Okay, mechanism of action inhibit the cell synthesis like bactericidal, and the example of drug penicillin and cephalosporins. Inhibitor of protein synthesis, bacteriostatics or bactericidal. Okay. Inhibition of nucleic acid synthesis, bactericidal like fluoroquinolones. Disruption of cell membrane like bactericidal like polymyxins. Antimetabolite activity like bacteriostatics. Example is sulforamide inhibit the folic acid synthesis. Okay. Resistance. Overuse, misuse, incomplete course, or agriculture uses. These are the and mechanism. Enzyme degradation, alter the target cells, flex pump, efflux pump or reduce the permeability. Okay. Side effect: allergy, gastrointestinal upset, nephrotoxicity and ototoxicity. Okay, this is the side effect of antibiotics. And this is all about the today's lecture. In today's lecture, we will discuss about the anti-cancerous agent or antibiotics. Please follow ITLS Academy on Instagram, Facebook, Twitter, YouTube, WhatsApp, LinkedIn, and also get it on Google Play Store. Thank you so much for watching my video. Please like, share, and subscribe ITLS Academy. Thank you.